Actually, when I was in high school, I lived in Urbana, and my aunt was head of a visiting nurses association with the health department in Danville, and she asked me to help her with the health fair out at Danville Junior College, and I picked up an application for a lab school, which was at St. Elizabeth Hospital, and I applied, and that's how I came to Danville. The lab school at that time was for a clinical laboratory assistant. It was a 12-month school. It actually started in July. I got out of school the end of May, so I had a month out of high school. I started, and during that 12 months, they teach you all aspects of the clinical laboratory. And at St. Elizabeth at that time, they had almost all clinical laboratory assistants with maybe only one or two med techs. So we were trained to do all aspects of the laboratory at that time. Well, attending that lab school, and again, I'll say I love science, I love learning about biology. I actually lived at the hospital for 2 years, and well, I took my training and then I saved up money for a year while I was there. But during that time, I decided I wanted to stay in Danville, and they put me as the second shift supervisor. And when I think back, I was only 19. I was the lab supervisor for the second shift, and I was the only person that worked those hours. Over the years, it ended up I left there 7 years after I began so I could start a family. But I learned an awful lot in those years at the lab because I had to work on all floors, do lab work for all departments, stats, pre-ops, routines, and it was a very good education in itself because I worked very closely with the pathologist who was very kind and taught me a lot of things. Then, after I had my children and stayed home for 4 years, I decided it was time to go back to work, and I actually took a job at the Polyclinic to work part-time in the lab on North Street, which was the first Polyclinic. And shortly after that, found out I was pregnant again, so I stayed home for another year. But after that, I came back to work. This time the Polyclinic was at 200 South College. It was in 1983. I was hired for 3 days temporary to fill in for the new urgent care department they had just opened. And I've been here for 27 years. So I just felt that they were very kind to me. They gave me lots of opportunities. If you really are willing to learn and you're willing to do any job that they give you, you can go a lot of places. I think it really helps when you have healthcare experience, no matter which part of healthcare, because you really need to understand what the doctors go through on a daily basis. You have to have empathy for the patients and what they go through, and you really need to know what those employees in the different departments do and what their challenges are every day. And if you can kind of wrap it all up together to make everything run smoothly, that's the challenge of an administrator. A good administrator I don't think should be really visible. They should just make everybody's job much easier. My favorite parts of being an administrator are getting to learn new things all the time. Healthcare is always changing. The governmental rules are changing. Technology changes. So those challenges are probably the most exciting. I don't think anybody likes a job where they do the same thing over and over, and healthcare is not one of those, no matter which department you work in. The part I like the least is when there are economic downturns and we have to make cuts, and I don't think of them as just cuts. I think of them as losing people that have worked here and have worked hard, and that's probably the most difficult part for me because I learn to know everybody so well and become friends with them, and sometimes there's difficult choices that you have to make, but to keep a business viable, and healthcare is just as much a business as any industry is, sometimes we have to make some hard choices. I think nursing is still a good opportunity for many people, but some of the lesser known fields as lab techs, ultrasound people, people who specialize with CAT scans, MRIs, physical therapy, home health. There are a lot of aspects to medical care that aren't just general but are more specific, and the jobs are there. You just need to go and take the training to do them, So it might be wise to just check the local hospital or your clinics and see what job openings they have and take it from there as to what might give you a good job in the future. DACC has certainly risen to the call, and they started a lab tech program, they have radiology program, they have an ultrasound program. Basically all you have to do is just find out what programs are there, and I almost guarantee you if it's in healthcare you'll be able to find a job when you get finished. The other thing that with healthcare, because everything's moving to electronic health records, is the computer side of healthcare. Most people think of more the medical side, but the information systems, that's the government's trying to get everybody on electronic health records. We currently are in the process, and you really need good support staff with your computer department. Some of the electronic health records have some automatic coding to help prompt the doctors a little bit, but it's still an issue when it comes down to submitting a claim to an insurance carrier. You have to code it properly or you won't be paid, so it is still an important part of the healthcare process. Sometimes when I look back and knowing that I started as a lab tech, I mean, I don't dwell on it a lot, but I think, how did I get this job? A lot of it is just self-motivation, willing to learn, wanting to learn anything and everything about whatever job you have. And I think that speaks to any industry that you're in. If you're willing to learn, if you're willing to work hard, if you're willing to show up for work every day, and you learn to work well with others, you will do well in no matter which field you choose. I feel a little bit lucky. I think I was in the right place at the right time. And I don't know why I'm so lucky, but I feel like I'm lucky to be here, and I'm grateful every day to have this job. I am. I guess I would just say to anybody young, don't limit yourself. Sometimes people put self-limits on themselves. If you want to do something different or you want to learn something different, tell somebody, do what it takes to get that done, because in the end, you are the only one that's really responsible for yourself. And as long as you're going to work, you might as well have a better paying job than an entry-level job. So do what it takes to move yourself up the ladder.